expert. This month's topic, fireworks safety. Joining me now is Dr. Chris Andershock, Medical Director of the Baptist Memphis Emergency Department. Dr. Andershock, thanks so much for joining us.
Thank you for having me.
Tell me why and how most fireworks injuries occur.
It's lack of supervision and using the fireworks inappropriately.
What type of fireworks cause the most injuries?
It's divided into age groups. In the younger children, sparklers cause a lot of burns, and in the teenage and young adult demographics, you see projectiles like bottle rockets causing the most injuries.
What are some of the things that you can do to prevent injuries?
The most important thing is to have adequate supervision by a responsible adult. The second most important thing would be to use the fireworks as they're directed or as they're supposed to be used. The third most important thing would be to use safety goggles, wear protective devices, clothing, and have a bucket of water around.
When it comes to safety goggles, you have some in your hands, and they're much hipper than what we normally think of as safety goggles.
Yeah, well, I was going to have Christy model these for us, but it looks like I'll have to do it. These cost $5 at Home Depot, and certainly they look actually like you could be seen in public with them. I think safety goggles have really gone through a significant transformation in that you can get a pair that looks semi-attractive and they're very inexpensive. There were studies back in the 80s that found that people were not wearing safety glasses because they thought they made them look funny. So there's no excuse for that now, and eye injuries are probably the most devastating effects of fireworks accidents that we see, and they're completely avoidable.
And if you do get injured, what should you do?
Well, it really depends on the severity. Simple burns can usually manage with first aid. Wash the area off and treat it with a cool compress, bandage it. If it's deep or you think it's problematic, certainly come and see us in the emergency department. We have antibiotic creams and pain medication we can give. The eye injuries, every one of those should be seen. They're avoidable, but there is a lot of delicate structures in the eyes, and if you are hit in the eye or you're burned in the eye, please come see us and we'll evaluate you.
Dr. Andershock, thanks so much for joining us.